Medical cannabis can treat many of the symptoms of cancer, as well as many of the treatment side effects. Now, can cancer actually stop the growth of cancer? While nobody would say yes at this point, there is promising research that suggests that it might. So let's talk about it. Hey everybody, it's Dr. David. I am a medical cannabis certifying physician for both adults and children in Tampa, Florida, and I've been doing so since about 2016. One of the most common reasons in adults that I see for the use of medical cannabis is for cancer. And on top of that, probably one of the most accepted reasons for using medical cannabis is for cancer. I do see a lot of patients who are referred by oncologists. They seem to be the first mainstream doctors to have understood the benefits of it, especially because of the anti-nausea effects of chemotherapy. That's probably where it got its start. But they're now recognizing that there are other benefits to it as well. Now, in terms of the types of symptoms that medical cannabis can help, probably the most helpful is for pain. People with cancer, whether they had surgery to remove part of the tumor, and that can be very painful, but bone cancer and just the growth of the tumors itself can cause excruciating pain in some patients. And the cannabis, because of the effects of how it works on our pain receptors, can really dull that kind of pain response and can make people feel a lot better. And one of the nice things, especially if it's inhaled, almost instantly within the matter of a couple minutes. Now, another thing that it can be very helpful with is for anxiety. Now, of course, anxiety itself is not from cancer directly, but more that a person who has cancer has a much better chance of being anxious because, let's face it, if you've been diagnosed with cancer, there's all types of uncertainty that you have. How will this affect you? Will this potentially take your life early, God forbid? What are you going to go through in terms of the types of treatments, which most people have heard could be rough? What if impact might this have on a person's family? All that they're going to have to go through watching a patient suffer. Or even if a person has more advanced cancer and it looks like they're not going to survive, how financially will it be for the rest of the family, especially if the person who has the cancer is the primary breadwinner in the family? So of course, anything that we could do to reduce anxiety, that can be very helpful. Now, another thing that many people with cancer have is they have what are called wasting syndromes. A person who has cancer, a lot of the time they are in a very advanced metabolic state. The cancer is growing, using up a lot more calories, and that could make it difficult for people to, of course, keep up. And of course, depending on where the cancer is, if it's in the stomach, abdomen especially, that could also cause different types of problems with a person's appetite, because maybe it just doesn't feel good there, but also just in terms of just being able to keep the weight on. So one of the things that we certainly do know about the effects of THC is that it can induce appetite, the munchies. In fact, it's one of the more common side effects that people don't want if they don't have cancer, is that they may gain some weight because they're eating more. In this particular case, though, we are able to use that to our advantage to help patients keep weight on. And one of the other things is it can improve sleep. Now, in and of itself, just being able to fall asleep and stay asleep, but one of the things that keeps cancer patients up is anxiety or is pain. So not only can the cannabis potentially have a direct impact on the sleep cycle itself and getting into a sleep and staying asleep, it can also reduce two of the symptoms that are most likely to cause sleep disturbances in the first place. Now, of course, there are significant side effects associated with many of the cancer treatments, whether it's the chemotherapy, radiation, biologicals, etc. They all can cause significant side effects. And probably the most common side effect is nausea and vomiting and abdominal pain. And again, if that can be treated by the cannabis and the person's able to feel better, they're going to be able to tolerate their chemo better, their radiation better. So that can be really, really helpful. Some people may find it works better inhaled. A lot of people may find that taking it orally and letting it go directly to the gut, that can be helpful as well. And of course, if as far there can be pain associated, some of the infusions themselves, the active ingredients can cause people pain. And again, if we can minimize pain, that would be great. And of course, one of the things that we do know about chemotherapy itself is that it can really knock a person's appetite out. So again, if we can get that appetite back, just like the person who has cancer as the primary symptoms, it can be very helpful here as well. And most importantly, what cannabis is doing, regardless of which of those symptoms are improved, it's improving the person's quality of life. Right? I mean, like most people with cancer, they're bedridden, they feel lousy all the time. But if you're able to get up out of bed, to be active, to be able to have more joy in life, of course, that's going to be a very helpful thing. And we know that mental health is a big part of how our body handles physical health. Now, in terms of this new study that has just come out, which I think is pretty fascinating, and I'm going to actually be talking about 3 different studies, but they're all related to not treating the patient directly. So we're not talking about it stopped cancer growing in a patient. This is all based upon laboratory data. So the most recent, one of the more recent ones is from the Technion, which is a health university in Israel, probably their most advanced medical sciences types of institution. And the Technion, what they did is they matched genetics. So they found that they looked at 12 different strains, 12 different extracts of cannabis, and they looked at 12 different types of cancer cell lines. And what they were able to find is that there were certain lines able to be treated by certain types of cannabis, certain strains of cannabis, but not others. And one of the things that they actually did was not only did they show that it impaired the survival and the proliferation of specific cells, and again, when the matching was right, but it also induced something which is called apoptosis. Now, apoptosis is the programmed killing of abnormal cells like cancer cells. And so that's obviously a good thing. So not only can, within an organ itself, if there's an organ and the cells are infected, it can kill that off, not just stopping the further growth in the lab cells as well. And the interesting thing here is that they also did it with only a THC extract, but not the whole plant type of medicine with the terpenes and with the other minor cannabinoids. When they did it with only THC, it didn't cause the same stopping of the cancer, which is pretty fascinating. Now, at Hadassah University, which is the main teaching hospital university in Israel, they did some other things. They did what's called a cell model study, and what they did is they created a cell model of cancer itself. And then they found that there was a particular product that they had investigated and researched, and it did cause 90% of the cancer cells to die in the laboratory. Again, this is not in humans. And this particular product was actually a combination of both cannabinoids as well as medicinal mushrooms, which is interesting because then, of course, we could say, well, maybe it was one but not the other. But the interesting thing is because they were in countries where things like THC, some of the research, not all areas and patients could get access to THC or to psilocybin, which is the main psychoactive mushroom or the ingredient within mushroom, they did it only with other mushrooms and other cannabinoids, but not THC and magic mushrooms. Now, a third thing that they did at the University of Maryland in their Department of Food Health Sciences, and they were looking specifically at the effects of CBD on colorectal cancer cells. And what they found is that it was a dose dependent, the higher the dose that they gave, the more of an effect that it had in stopping the ability of these cancer cells to survive. So, of course, you can kill the cancer cells, but also, obviously, cancer cells on their own will replicate. So, of course, if you can slow down the replication, that's obviously very helpful as well. And again, depending on what dose they used, that made a big difference. But the interesting thing, and again, they weren't doing this with THC, but they found it was true for other minor cannabinoids as well. CBDV, CBG, CBGV, and CBL in particular were the other ones that were looked at. So basically, here we are in a very early part of this type of research, but it's very promising. And obviously, thankfully, the side effects of these types of treatments relative to other treatments, they're pretty manageable. They're pretty minimal if they happen whatsoever. But it's good to know that scientists are researching this, and certainly anything that we could do to help. We've been talking about a moonshot against cancer, and it would be so wonderful if we are able to find especially natural treatments that are able to treat the cancer in and of itself. But much, much more research is going to be needed here. Much more research is going to be done. It's happening around the world. I anticipate it will continue to happen. Here in America, assuming that the final steps of the FDA rescheduling from a category, a class 1 down to a class 3 takes place, and we'll be able to do a lot more research. So overall, I would venture to say almost every patient with cancer could benefit from medical cannabis, at least in terms of reducing side effects or symptoms. Have a nice day.